In this podcast episode, Tucker Carlson interviews Calley and Casey, two prominent voices in the conversation about health, nutrition, and the pervasive influence of Big Pharma on public health. The discussion delves into the alarming state of health in America, the role of the food industry, and the implications of medications like Ozempic and the birth control pill. Calley and Casey begin by painting a grim picture of the current health crisis in the United States. They highlight that 74% of American adults are overweight or obese, and nearly 50% of children face similar issues. The statistics are staggering. 50% of American adults have prediabetes or type 2 diabetes, and the rates of chronic diseases such as cancer and mental health disorders are rising sharply. The duo emphasizes that these conditions are not merely unfortunate statistics, but represent a systemic failure of the healthcare system, which is more focused on treating symptoms than addressing root causes. A significant portion of the conversation centers around the influence of Big Pharma and the food industry on public health. Calley and Casey argue that the healthcare system is designed to profit from illness rather than promote health. They point out that the largest and fastest-growing industry in the U.S. is healthcare, which thrives on the existence of chronic conditions. The more patients are treated for these conditions, the more money is made, creating a perverse incentive structure. The discussion also touches on the historical context of the food industry, particularly how processed foods have become the norm. Calley explains that the food industry, particularly in the 1990s, was heavily influenced by the tobacco industry, which shifted its focus to food production after facing scrutiny over the health impacts of smoking. This led to the rise of ultra-processed foods, which are designed to be addictive and are now a staple in the American diet. The consequences of this shift are evident in the rising rates of obesity and related health issues. The conversation then shifts to Ozempic, a medication that has gained popularity for weight loss. Calley and Casey express concern over the widespread use of Ozempic, particularly among young people. They argue that while it may provide short-term weight loss benefits, it does not address the underlying metabolic dysfunction caused by poor dietary choices. Instead, they emphasize that the focus should be on lifestyle changes, such as improving diet and exercise, which can lead to sustainable health improvements. Casey highlights that the pharmaceutical industry has a vested interest in promoting drugs like Ozempic, as they can generate significant profits. The duo points out that the medical community often fails to address the root causes of obesity and metabolic dysfunction, opting instead for pharmaceutical solutions that do not resolve the underlying issues. They argue that this approach is not only ineffective but also dangerous, as it perpetuates a cycle of dependency on medications rather than encouraging healthier lifestyles. The discussion also includes a critical examination of the birth control pill, which has been a cornerstone of women's health for decades. Casey shares her perspective on the pill, noting that while it has provided women with greater control over their reproductive health, it has also led to a disconnection from the natural hormonal cycles that govern women's health. She emphasizes that the pill is often prescribed without fully understanding its long-term effects on women's bodies and overall health. Calley adds that the pill is frequently used to address symptoms of conditions like polycystic ovarian syndrome, PCOS, without addressing the underlying metabolic issues that contribute to these conditions. He argues that this approach is symptomatic of a larger problem within the healthcare system, where quick fixes are prioritized over comprehensive care. The duo stresses the importance of understanding the implications of hormonal interventions and the need for a more holistic approach to women's health. Throughout the podcast, Calley and Casey consistently return to the theme of nutrition as a foundational element of health. They argue that the current healthcare system often overlooks the importance of diet and lifestyle in preventing and treating chronic diseases. They encourage listeners to prioritize whole, unprocessed foods and to be mindful of the ingredients in their diets. Casey shares her personal journey of moving away from a traditional medical career to focus on nutrition and lifestyle medicine. She emphasizes the need for healthcare professionals to be educated about the impact of food on health and to advocate for dietary changes as a primary intervention for chronic diseases. Calley echoes this sentiment, highlighting the need for a cultural shift in how we view food and health. As the conversation draws to a close, Calley and Casey call for systemic change within the healthcare and food industries. They argue that the current system is rigged against the average American, particularly those from lower income backgrounds who may not have access to healthy food options. They emphasize the need for policies that promote healthy eating and reduce the prevalence of ultra-processed foods in the American diet. The duo also highlights the importance of empowering individuals to take control of their health through education and access to resources. They encourage listeners to be proactive in seeking out information about nutrition and to advocate for changes in their communities that promote healthier lifestyles.